addition to that, one of the other sort of hot things we're working on these days is around employee population health. So we'll take a look at any employee population from a couple of thousand employees to hundreds of thousands of employees, and try and identify population health risks within that group, so that an employer can then design wellness programs to try and encourage and incent healthy behaviors. Actually, as I was walking in the building today, I saw this sign that said, "Faculty and staff do something, and you get a $100 reward." That's the type of thing my company does. If you have healthy behaviors, you get rewarded to have that healthy behavior. So we stratify all these claims into, say, people are well, people are at risk, maybe they're a smoker, people have chronic conditions, maybe they're managing those conditions or not managing those conditions, or someone might have a catastrophic situation. And then we try and develop programs and incentives to get people to do the right thing. So if you're already healthy, how do we keep them healthy? If you're a diabetic, how do you make sure you're following the right protocols for your condition? And just the whole idea is to try and keep health claims costs down. And then of course the other added benefit is a healthy employee generally means you're a productive employee. You're not calling in sick all the time and that kind of thing. So that is what I've been up to for the last 12 or so years. I think from a consulting perspective, no matter what kind of consulting you may do, there are reasons employers hire consultants. It's either because or companies hire consultants. It's either because they don't have the capacity to handle the work inside themselves. They probably are capable of doing it, but they just might not have the internal resources to do it. Or, and the more fun part of the job is they're looking for an expert. They're looking for someone who can teach them something and can build credibility to something that they're trying to accomplish within their world. So that's my story. I look forward to your questions after Ben.
Hi, I'm Ben Landsberg. I'm the new one of the group. I just graduated in December 2009. So when I was at Northeastern, I came in undecided but leaning towards physics. But my AP situation being what it was, there were no physics courses available the first semester, so I took some economics and math courses. And I knew from the beginning that I kind of wanted to do something with applied math, but I wasn't sure where. But economics really turned out to be a good fit for me. So I ended up doing a combined BSMA in economics with a math minor throughout my time. I think the co-op program was extremely helpful for me. My first co-op I did at Wellington Management, and basically realized this was an institutional fund management company, which I realized I really did not enjoy kind of that corporate culture. And my second and final co-op I did at Analysis Group, the company I am now, where I'm at now. I don't know, for those of you who are economics majors, Professor Alper, who's the chair of the undergrad department, basically, was talking to me and recommended that I look into them, economic consulting in general, as another, option of the sort of thing to do. And so I guess during my internship at AG, being there for 6 months, whereas the typical intern, was there for 2 to 3 months, I really got an opportunity to do a lot of different things, but also follow a project from start to finish. The way that AG works in general is the higher-ups in the firm will bring in different types of projects. We do health outcomes research, we do litigation support, so basically supporting experts for testimony in big lawsuits. And we do strategy work, particularly in the pharmaceutical industry. So pharmaceutical companies are coming out with new drugs or treatments, and they want to figure out how to price them and place them in the market. That's something we can help with. So, these projects can stretch different lengths of time. I was there for 6 months. It happened to correspond exactly to small healthcare litigation, which I had the opportunity to work on and then come back a couple months after I had left when the case went to trial to basically do some follow-up work on it. And I think kind of that process of seeing things from start to finish and realizing that the experience at AG would be doing a lot of engaging different types of basically, research and applied math or analysis to try and reach an outcome favorable to the client. was something that was really appealing to me. So, when I started looking at economic consulting firms when I was about to graduate, started doing the rounds, and then got an offer from AG and sort of killed my motivation to look elsewhere because I already knew it would be a good fit. So I'd say, given that, starting at AG, and I've been there for about 13 months now, and this stretch has been pretty much what I expected. I've worked on a lot of different types of cases. Just to list a few, something involving a contract dispute between a hospital and radiology practice, a healthcare cost model associated with the treatment of psoriasis, a dispute between an ex-manager at a financial company and the company when they messed around with his retirement benefits, a series of large technology patent infringement cases. I guess I'm really enjoying it because the work changes very frequently in terms of the subject areas that you see, but also the nature of the work itself. I'll do a lot of programming in SAS, which is a statistical programming package, to basically tease out relations from data and summarize data in a way which is easy to pass on to the client so that they can understand. I'll do a lot of qualitative research in random areas of finance and healthcare and technology. For a case I'm working on right now, I'm looking at a lot of industry, mobile phone industry data put out by companies like Gartner and IDC. You've ever heard of them? But I think for a first stop in a career, it's a really good opportunity to see a lot of things, build up a lot of varied skills in different technology, different software packages, and sort of get a taste of lots of industries to try and figure out ultimately where I want to specialize and move from there. So as far as where it's ultimately leading, so my position, my title is an analyst at an analysis group, which is kind of the basic right out of school position. So there's a promotion you can get a couple years in, but ultimately it turns into a 3 to 5 year position out of school, at which point they encourage you to go back to school. I'm considering a PhD. Other analysts go on to MBAs or other master's programs, et cetera, at which point you kind of, hopefully by then I'll have figured out exactly what's been the most interesting for me and pursue that directly. Alternatively, a lot of people after school will end up coming back in a managing position in the company, and that's, I guess, also a possibility down the line. And I guess so. One thing I should say is economic consulting is not management consulting. So management consulting is more you visit companies, you interact with them, and you help them to redefine some internal process to work more efficiently. What Analysis Group does, and what LECG and Charles River Associates and the Brattle Group and all these other economic consulting firms do, is really it's more behind the scenes type work, and it's very varied types of projects. So you can probably tell from the list I gave before, but if you're working within litigation, you're supporting an expert who is an expert in some random field that happens to relate to the case. So it's not. There's a lot of opportunity to see a lot of different industries, but it's also varies extremely from case to case. Similarly, the health outcomes practice within is sort of its own specialized beast of a lot of people who have MPHs, Masters of Public Health, and other kind of statistical backgrounds who are using that to sort of do strategic advising for companies, but sort of outside of kind of the inner workings of the company. It's like, we'll work on a clinical study, or we'll work with a data set that they have, as opposed to the company itself. I think that's an intro.